Hello, everyone. Hello, welcome, welcome, welcome. Welcome, welcome. Give everybody a few seconds to get connected with their internet. Hello, hello, hello. All right, my name is Phyllis, and we're going over the CNA practice test today. And welcome to Florida Training. All right, let's go ahead and get started. And I hope everyone had a wonderful Thanksgiving. Hello. All right. All right, let's go ahead and dive right on into the first question and get started. And if anything you miss, you can always go back on to the channel and start it from the beginning. When should postpartum care be performed? A, after the family views the body. B, immediately after the doctor pronounces the patient dead. C, when rigor mortis sets in. D, after the body goes to the morgue. Drop your answers in the chat for me, please. Drop your answers in the chat. A, B, C, or D. And let me know what you think the answer is. A, B, C, or D. All right. All right, I see some B's. I see some D's. All right, let's go ahead and dive right into the answer. If you chose B, you're absolutely correct. Immediately after the doctor pronounces the patient dead, post-mortem care should be performed as soon as the doctor pronounces the patient dead to ensure the body is prepared for family viewing. Religious ceremonies are transportations to the morgue. This care typically includes closing the eyes, repositioning the body, cleaning, and removing any medical equipment. A walker may be used if the client can A, support some weight, B, use her hands well, C, balance without help, D, walk independently. Go ahead and drop your answers in the chat and let me know what you think it is. A, B, C, or D. Drop your answers in the chat. A, B, C, or D. Drop your answers in the chat. If you are just not joining, welcome to Florida Training. We are going over the CNA practice quiz tonight. Thank you for joining. Thank you for joining. All right, I see some A's, a lot of A's, some C's. Let's go ahead and dive right into the answer. If you chose answer A, you are absolutely correct. Support some weight. A walker is used by individuals who need assistance with balance and support. If the patient can support some weight, they are likely able to use a walker to provide stability while walking. Those who are unable to support weight may require a different type of assistance device, such as a wheelchair. A cane should be used on A, the affected weak side of the body, B, the side with the strongest arm, C, the unaffected strong side of the body, D, the weak side one day and the strong side the next day. Go ahead and drop your answers in the chat and let me know what you think it is. A, B, C, or D? Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose answer C, you are absolutely correct. The unaffected side of the body, which is the strong side. A cane should be used on the unaffected side, strong side of the body. This provides support while allowing the patient to maintain balance and reduce strain on the weaker side of the body. A nurse aide is collecting linens for a bed change and drops a sheet on the floor. What should the nurse aide do? A, ignore it and leave it on the floor. B, place it back on the linen cart. C, disregard it in the soiled linen hamper. D, use it anyway. Go ahead and drop your answer in the chat for me. Drop your answers in the chat, please. Go ahead and drop your answers in the chat. A, B, C, or D. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Discard it in the soiled linen hamper. If linen falls on the floor, it is considered soiled and should be discarded in the soiled linen hamper to prevent the spread of germs. The sheet should not be reused. It may be contaminated. When applying a cold treatment to a patient, it is important to observe the patient closely for signs. A, redness. B, dizziness. C, fainting. D, cyanosis. Drop your answers in the chat. Drop your answers in the chat and let me know what you think it is. Drop your answers in. All right. See some D's and A's. Let's go ahead and jump right into the answer. If you chose answer D, cyanosis, you are absolutely correct. When cold treatments are applied, it is crucial to monitor the patient for signs of skin damage, including cyanosis, blush discoloration of the skin, which indicates poor circulation or tissue damage due to prolonged exposure to cold. The purpose of correctly positioning the client is to A, prevent skin breakdown, B, maintain function of joints and muscles, C, increase comfort, D, all of the above. Drop your answers in the chat and let me know what you think it is. Drop your answers in the chat and let me know what you think it is. All right, let's go ahead and dive right on into the answer. If you chose answer D, you are absolutely correct. All of the above. Proper positioning helps prevent skin breakdown, maintains joint and muscle function, and increases comfort for the client. It is essential for promoting the patient's overall health and well-being. Excuse me. When transferring a patient from a stretcher to the bed should be placed in what position? A, level with the stretcher. B, lowest horizontal position. C, 6 inches lower than the level of the stretcher. D, high Fowler's position. Drop your answers in the chat and let me know what you think it is. A, B, C, or D. Drop your answers in the chat and let me know what you think it is. A, B, C, or D. If you are just now joining, welcome. My name is Phyllis. Once again, we are going over the CNA practice quiz tonight. Go ahead and drop your answers in the chat. Let's go ahead and dive right into the answer. I see some A's and D's. Let's see what the answer is. If you chose letter A, you are absolutely correct. Level with the stretcher. When transferring a patient from a stretcher to a bed, the bed should be at the same level as the stretcher to ensure a smooth and safe transfer. This minimizes the effort required for the transfer, reduces strain on the caregivers, and ensures the patient's safety by avoiding unnecessary height differences that could cause instability. Using proper body mechanics and assistive device is also crucial during the transfer to prevent injury. The preferred way to remove a bedpan from a client who is unable to lift her buttocks is to A, use a mechanical lifting device, B, have another nursing assistant lift the client, C, turn the client to the side while holding the pan, D, slowly slide the pan from under the client. Drop your answers in the chat and let me know what you think the answer is. A, B, C, or D. A, B, C, or D. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose answer C, you are absolutely correct. Turn the client to the side while holding the pan. When the client is unable to lift her buttocks, turning the client to the side while carefully removing the bedpan ensures comfort and prevents injury. This method is safer than sliding the pan from underneath or using another person to lift the patient. After shaving a patient with a safety razor, the nurse should A, cover it before discarding, B, wrap it in a paper towel and drop it into the trash can, C, dispose it in a sharps container, D, place it in the patient's drawer for reuse. Drop your answers in the chat and let me know what you think it is. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Dispose of it in a sharps container. After using a safety razor, it should be disposed of in a sharps container to prevent injury and ensure proper disposal of potentially hazardous objects. This prevents accidental cuts or needle stick injuries. When a client complains that his dentures are hurting, the appropriate action is to A, encourage him to wear the dentures more often, B, report the complaint to the charge nurse, C, report the complaint to the physician, D, put the dentures on the bedside table. Drop your answers in the chat and let me know what you think it is. Drop your answers in the chat. And let me know what you think it is. I see some B's. I see some B's coming in. Let's see, a lot of B's. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Report the complaint to the charge nurse. When a client complains about pain from their dentures, it is important to report this to the charge nurse for further evaluation. The charge nurse or healthcare provider may need to adjust or replace the dentures or assess for other causes of discomfort. A nurse aide notices that a water pitcher has spilled onto the floor. The best action for the nurse aide to perform is to A. Wipe it up immediately, B. Cover it with a towel, C. Notify the charge nurse, D. Contact housekeeping. Drop your answers in the chat and let me know what you think it is. Drop your answers in the chat and let me know what you think it is. Drop your answers in the chat. Drop your answers in the chat. All right, let's go ahead and dive right into the answers. If you chose A, you are absolutely correct. Wipe it up immediately. The best action is to immediately wipe up the spill to prevent any accidents, such as slips or falls. Ensuring the floor is dry, minimize the risk of injury to both the patient and staff. While notifying housekeeping is helpful, the immediate step is to clean up the spill. Okay. Upon entering a room, the nurse aides notice that the patient is not breathing. The aide's first action is to A. Start chest compressions, B. Lay the patient down on his back, C. Give 4 quick breaths, D. Call for help. Drop your answers in the chat. Drop your answer in the chat. All right, I see a lot of D's. All right, let's go ahead and dive right into the answers. If you chose D, you are absolutely correct. Call for help. If a patient is not breathing, the first step is to call for help to get emergency medical assistance. Includes activating the emergency response system. After calling for help, the aide can proceed with CPR if trained and instructed to do so. The priority is to get professional assistance quickly. A patient is on bed rest wearing anti-embolic stockings. How often should the stockings be removed? A. Never. B. Every 2 hours. C. At least twice a day. D. Every 6 hours. Drop your answer in the chat. A, B, C, or D. Drop your answer in the chat. A, B, C, or D. Let's see what we got. See some C's. I see some B's. Let's go ahead and dive right into the answer. If you chose answer B, you are absolutely correct. Antiabolic stockings should be removed every 2 hours to assess the skin and promote circulation. Keeping the stockings on too long can lead to skin breakdown or discomfort, and it is necessary to check the skin for redness and irritation periodically. Pressure ulcers. Decubitus ulcers can be prevented by A. Changing the client's position every 2 hours, B. Placing a gel or foam pad on the top of the mattress, C. Increasing the client's compensation of vitamin C, D. Both A and B. Consumption, I'm sorry, y'all. A, B, C, or D. A, B, C, or D. Oh, excuse me. A, B, C, or D. A, B, C, or D. All right, I see some A's, I see some D's. Let's go ahead and dive right into the answer. All right, if you chose D, you are absolutely correct. Both A and B. Pressure ulcers can be prevented by repositioning the patient every 2 hours to alleviate pressure on bony prominence, and by using specialized padding such as gel or foam pads to reduce pressure from the mattress. While vitamin C is important for skin health, proper repositioning and cushioning are more directly related to prevention. The first step in getting a client up to walk is to A. Sit the client on the side of the bed. B. Put the client's slippers on. C. Check the activity order. D. Tell the client that he will be getting up. Go ahead and drop your answers in the chat. A, B, C, or D. A, B, C, or D. All right, I see some A's, I see some B's, I see some D's. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Check the activity order. Before assisting a client to walk, it is essential to verify the activity order provided by the healthcare provider. This ensures that the client is medically cleared to engage in ambulation and prevents potential harm if there are restrictions on movement. Skipping this step could result in injury or complications if the client is not permitted to walk. A client's vital signs are as follows: blood pressure 118 over 80, temperature is 98.8, pulse is 80, respiration is 30. Which findings should be reported at once? A, blood pressure, B, temperature, C, pulse, D, respiration. Go ahead and drop your answer in the chat for me. A, B, C, or D. All right, I see some A's, D's. Go ahead and drop your answer in the chat. All right, let's go ahead and find out what the answer is. If you chose D, respiration, you are absolutely correct. A respiration rate of 30 is abnormal and should be reported immediately. Normal respiration rates for adults range from 12 to 20 breaths per minute. A rate of 30 is elevated and could indicate respiratory distress or other serious conditions. All of the following can cause an inaccurate oral temperature reading except A, drinking a hot cup of tea 10 minutes before the reading, B, using an electric thermometer, C, failing to shake down a glass thermometer, D, a vigorous exercise prior to the reading. Go ahead and drop your answers in the chat for me. Drop your answers in the chat. A, B, C, or D. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose answer B, you are absolutely correct. Using an electric thermometer. Using an electric thermometer is generally a reliable method for measuring oral temperature. However, drinking hot or cold beverages, failing to shake down a glass thermometer, or vigorous exercise can all cause inaccurate readings. The electric thermometer is less prone to errors related to these factors. Diastolic blood pressure is determined by A, listening to the first clear sound, B, listening for the last clear sound, C, subtracting the lower number from the top, D, adding the top and bottom numbers. Drop your answers in the chat. A, B, C, or D. A, B, C, or D. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Listening for the last clear sound. Diastolic blood pressure is recorded when the last clear sound is heard as the cuff pressure is released. The sound indicates the point at which the heart is at rest between beats. The diastolic pressure is determined by the first sound heard when the blood begins to flow. All of the following are correct when measuring blood pressure except A, do not assess blood pressure in an arm with an IV running. B, do not take blood pressure in the same arm as where a person has a mastectomy. C, use the biggest cuff possible to get an accurate reading. D, make sure the room is quiet so you can hear before taking blood pressures. Go ahead and drop your answers in the chat. A, B, C, or D. A, B, C, or D. Drop your answers in the chat. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Use the biggest cuff possible to get an accurate reading. It is important to use the correct size cuff for the patient's arm. A cuff that is too large or too small can lead to inaccurate readings. Additionally, you should avoid taking blood pressure in an arm with the IV, or a history of a mastectomy, and the room should be quiet to accurately hear the Korokov sounds. The first step in performing any procedure is to A. Explain the procedure, B. Gather needed equipment, C. Perform proper hand washing, D. Provide privacy. Drop your answers in the chat. A, B, C, or D. A, B, C, or D. Let's go ahead and dive right into the answer. Perform C. If you chose answer C, you are correct. Perform proper hand washing. Hand washing is the first and most important step before performing any procedure to reduce the risk of infection. This step ensures that any germs or bacteria are not transferred to the patient or the environment. After hand washing, the nurse aide can explain the procedure, gather equipment, and ensure privacy. Which of the following best destroys all bacteria on medical instruments? A. Soaking in alcohol. B. Washing with bleach. C. Sterilizing. D. Scrubbing in hot water. A, B, C, or D. Which of the following best destroys all bacteria on medical instruments? All right, I got some B's, C's dropping in. See some C's. Let's go ahead and dive into the answer. If you chose C, you are absolutely correct. Sterilizing. Sterilization is the process that destroys all forms of microbial life, including bacteria, viruses, and spores. It is the most effective method for ensuring an item is free from harmful microorganisms. Other methods like soaking in alcohol or washing with bleach are effective for reducing bacteria, but do not guarantee complete sterilization. In the event of a fire in a client's room, the nurse aide should first A. Notify the charge nurse, B. Turn on a fire alarm, C. Get the client to a safe place, D. Use a fire extinguisher. A, B, C, or D. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Get the client to a safe place. The first priority during a fire is to ensure the safety of the client. This includes evacuating the client from the room and moving them to a safe location. After that, the nurse aide should notify the charge nurse, activate the fire alarm, and if trained, use a fire extinguisher. Ensuring the client's safety is the top concern. Safe use of oxygen therapy includes A. Always setting the flow meter at 2 to 3 liters per minute. B. Using wool blankets only to keep the patient warm. C. Cleansing the nasal prongs each shift with alcohol. D. Using caution with oxygen tubing so the client does not trip and or get it entangled in furniture. Drop your answers in the chat. A, B, C, or D. A, B, C, or D. Go ahead and drop your answer in the chat. All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Use a caution with oxygen tubing so the client does not trip or get entangled in furniture. Oxygen therapy requires careful management to avoid accidents. The oxygen tubing should be arranged to avoid trips or entanglement, which could lead to injury or oxygen supply disruption. The flow rate of oxygen should always be as prescribed by the doctor, and nasal prongs should not be cleaned with alcohol. Wool blankets are not recommended due to risk of static electricity. During CPR, the client should be lying A, flat on a hard surface, B, with head and shoulders elevated, C, with the feet raised on a pillow, D, flat on the bed to prevent injuries. Drop your answer in the chat. A, B, C, or D. Drop your answers in the chat. A, B, C, or D. All right, let's see some A's. All right, let's go ahead and dive right into the answer. If you chose A, you are absolutely correct. Flat on a hard surface. When performing CPR, the client should be lying flat on a hard surface to allow for effective chest compressions. A hard surface ensures the compressions are deep enough to circulate blood. The bed or soft surfaces are not ideal for performing CPR as they may hinder proper chest compressions depth. If you chose answer D, you are absolutely correct. I'm sorry, y'all. Hold on. I'm sorry. A procedural manual is a book listening the procedures a nurse aide has been assigned to do. B, set of directions needed to complete a nurse's aide job description. C, book of directions for administrative medication. D, written set of instructions on how to perform procedures. A, B, C, or D. A, B, C, or D. I think some of you probably already seen it. My bad. My finger slipped the mouse. All right, let's dive right into the answer. If you chose D, you are absolutely correct. Written set of instructions on how to perform procedures. A procedure manual contains specific written instructions on how to carry out clinical tasks or procedures. This ensures that tasks are performed consistently and safe. It is a resource for nurse aides to understand how to carry out their duties properly. If a client cannot speak English, the nurse aide should A, have the family interpret, B, ask the charge nurse to arrange for an interpreter, C, call the doctor to talk to the client, D, tell the client that she cannot answer the question. Drop your answers in the chat for me. A, B, C, or D. A, B, C, or D. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Ask the charge nurse to arrange for an interpreter. If a client cannot speak English, it is important to provide effective communication. The charge nurse can arrange for a professional interpreter or use alternative methods of communication, such as a translation services, to ensure the client's needs are understood and met. The accepted way to identify a client is to A, check the bed name and number. B, check the identification band. C, ask the client's name. D, call the clients by name. Drop your answer in the chat. A, B, C, or D. A, B, C, or D? Drop your answers in the chat. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose answer B, you are absolutely correct. Check the identification band. The most reliable way to identify a client is by checking the identification band. This ensures the nurse aide is providing care to the correct individual, reducing the risk of mistakes. Asking client's name may not be accurate, as they may be confused or unable to respond. Which of the following best describes nail care? A. Nail care is not needed for the elderly. B. Use scissors for all nail care. C. All clients need nail care. D. Check the charge nurse for nail care instructions. Drop your answers in the chat. A, B, C, or D. Let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Check with the charge nurse for nail care instructions. Nail care needs varies for different clients, especially those with certain medical conditions. It's essential to follow the charge nurse's instructions, especially for elderly clients or those with diabetes, as improper nail care can cause injury or infection. While all clients may need nail care, the approach should be individualized. When performing period care on a male client, always A. Clean the scrotum first. B. Clean from front to back. C. Retract the foreskin if uncircumcised. D. Hold the penis at a 90-degree angle. A, B, C, or D? A, B, C, or D? And don't forget, guys, you can always go back if you subscribe to the channel and rewatch the video. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Retract the foreskin if uncircumcised. When performing perineal care on a male client who is uncircumcised, it is important to retract the foreskin to clean underneath it, then gently return it to its normal position. This helps prevent infections such as bolitis. Always clean from front to back and hold the penis gently, but retracting the foreskin is essential for proper care. Back rubs aid in all of the following except A. Improving posture, B. Improving circulation, C. Increasing one-to-one interaction, D. Relaxing the client. Drop your answers in the chat. Drop your answers in the chat. You guys are doing a good job tonight. You guys are doing a wonderful, wonderful job with answering. You guys are doing a wonderful job. Way to go, guys. All right, let's dive right into the answer. A. Improving posture. While back rubs are effective for important circulation, increasing relaxation, and promoting one-to-one interaction, they do not directly improve posture. Back rub help with muscle relaxation and stress relief, but do not alter posture. Posture improvements are typically achieved through physical therapy or proper body alignment. A client's elbows are dry and red. The nurse aide should A. report this to the charge nurse. B. Apply lotion to the elbows. C. Apply elbow protectors. D, perform range of motion exercise? Drop your answer in the chat. Go ahead and drop your answer in the chat. A, B, C, or D. I see a lot of A's. Let's go ahead and dive right into the answer. If you chose A, you are absolutely correct. Report this to the charge nurse. Dry and red elbows can indicate potential skin irritation or breakdown. The nurse aide should report this to the charge nurse so the appropriate interventions can be made, such as applying lotion, using elbow protectors, or recommending changing in the client's position. Simply applying lotion or performing range of motion exercises may not address the underlying cause. A decubitus ulcer can be caused by all of the following except A, poor nutrition, B, pressure on the skin, C, poor circulation, D, cotton clothing. A, B, C, or D. Go ahead and drop your answers in the chat. A, B, C, or D. A, B, C, or D. All right, let's go ahead and dive right into the answer. D, cotton clothing. Decubitus ulcer, known as a pressure ulcer, are primarily caused by prolonged pressure on the skin, poor circulation, and inadequate nutrition, which affects the skin ability to heal. Cotton clothing does not directly cause decubitus ulcers, although it could contribute to moisture accumulation, which could exacerbate skin breakdown. The main contributing factors are pressure, circulation, and nutrition. The nursing assistant shampoos a client's hair to improve all of the following except A, circulation to the client's scalp, B, the client's general appearance, C, the client's sense of well-being, D, the rate of the client's hair growth. A, B, C, or D. Drop your answers in the chat and let me know what you think it is. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. The rate of the client's hair growth. Shampoos and scalp massages can improve circulation to the scalp, enhance the client's general appearance, and contribute to the sense of well-being. However, shampooing the hair does not affect the rate of hair growth, which is primarily determined by genetics and overall health. When removing a soiled gown from a client who has an IV, the best action is to A, remove the opposite arm from the gown first, B, have the nurse remove the IV needle, C, disconnect the bag and tubing, C, slip the gown over the IV solution bag. Drop your answer in the chat and let me know what you think it is. All right, let's dive right into the answer. If you chose answer A, you are absolutely correct. Remove the opposite arm from the gown first. When removing a soiled gown from a client with the IV, it is best to remove the gown from the arm that does not have the IV first. This prevents accidental pulling and tugging on the IV site. The IV bag and tubing should remain secure, and the nurse aide should be cautious to avoid disconnecting anything during the process. Most hospitals have gowns with snaps on the sleeve to make gown removal easier. If a client does not eat at all, If the client does not eat all the food on his tray, the first thing an aide should do is A, notify the charge nurse, B, ask the client why he has not finished, C, remove the tray, D, urge the client to eat all the food. Go ahead and drop your answer in the chat. If you chose B, you are absolutely correct. Ask the client why he has not finished. If a client does not eat all the food on their tray, it's important to ask them about the reason for not finishing. There could be several reasons, including a lack of appetite, difficulty eating, or discomfort. Understand the reason will help in addressing the issue, whether it requires dietary adjustments or additional assistance with eating. The client states that a mistake has been made. There is salt on her tray, although the doctor has ordered a low salt diet. The nurse aide should A, explain this means no salt when preparing the food. B, tell the client not to use the salt. C, check the diet order. D, call the kitchen for a new tray. Drop your answers in the chat. Drop your answers in the chat. All right, let's dive right into the answer. If you chose C, you are absolutely correct. Check the diet order. If a client receives food that does not align with their prescribed diet, the nurse aide should first check the diet order and notify the charge nurse if needed. The charge nurse can clarify the order, and if there was a mistake, a new tray can be arranged. The aide should not explain diet instructions or make assumptions without verifying the information. Which of the following provides identification of the clients in long-term care facilities? A, identification bracelet. B, photograph. C, identification bracelet and photograph. D, calling clients by name. A, B, C, or D. A, B, C, or D. Drop your answer in the chat. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Identification bracelet and photograph. In long-term care facilities, clients are usually identified with both an identification bracelet and a photograph. This ensures accuracy in identifying patient and helps prevent errors in care. Calling clients by name or relying on a bracelet alone is not always sufficient for clear identification. Before transferring a client from the bed to a wheelchair, the nurse aide should sit her on the edge of the bed for a few minutes to A, rearrange her gown or clothing, B, prevent orthostatic hypertension, C, position and secure the wheelchair, D, rest and remove the transfer belt. Drop your answers in the chat now. Drop your answers in the chat. All right. If you chose answer B, you are absolutely correct. Prevent orthostatic hypertension. Sitting the client on the edge of the bed before transferring to a wheelchair helps prevent orthostatic hypertension, a condition where the blood pressure drops when standing, leading to dizziness or fainting. Allowing the client to sit and adjust before standing gives their body time to stabilize. The client's religion forbids eating meat. Beef stew is being served for lunch. The nurse aide should A. Tell the client to eat it because she needs protein. B. Tell the client it is all right since her doctor ordered the diet. C. Ask the nurse to call the kitchen. D. Tell the client that religious restrictions are not as important as her health. A, B, C, or D? A, B, C, or D? A, B, C, and D. Go ahead and drop your answer in the chat. Let's dive right into the answer. If you chose answer C, you are absolutely correct. Ask the nurse to call the kitchen. If a client's religion forbids eating meat, the nurse aide should promptly ask the nurse to call the kitchen for a substitute meal. It's essential to respect the client's religious belief and dietary restrictions while ensuring the client receives an appropriate meal. It is important to remember that dying patients A have the same needs for care as other patients. B need to be by themselves in a quiet room. C do not need to be consulted regarding their care. D are usually in pain. A, B, C, or D? A, B, C, or D? A, B, C, or D? Let's go ahead and dive right into the answer. If you chose answer A, you are absolutely correct. Have the same needs for care as other patients. Dying patients still have physical, emotional, and psychological needs, just like other patients. Providing compassionate care, maintaining dignity, and addressing comfort are key components of care. While specific needs may arise during the end of life process, they still require attentive and respectful care. Dying patients and their families A. always pass through 5 stages of dying in order. B. always accept death before it occurs. C. may go back and forth among the 5 stages. D. must go through all stages of dying before they die. Drop your answers in the chat and let me know what you think it is. A, B, C, or D? A, B, C, or D? A, B, C, or D? Let's go ahead and dive right into the answer. If you chose answer C, you are absolutely correct. May go back and forth among the 5 stages. The 5 stages of dying is proposed by Kubler-Ross. Denial, anger, bargaining, depression, acceptance are not always experienced in a linear fashion. Dying patients and their families may move back and forth between stages as they process the reality of death. Acceptance may occur early or late in the process, and not all patients and our families experience all stages. Which of the following is a possible early sign of dementia in an elderly client? A. Refusing to eat a meal. B. Not knowing who she is. C. Frequent urination. D. Complaining of headaches. A, B, C, or D? Drop your answers in the chat and let me know what you think it is. All right, let's go ahead and dive right into the answer. If you chose answer B, you are absolutely correct. Not knowing who she is. One of the early signs of dementia, including Alzheimer's disease, is confusion about identity, such as forgetting one's own name or not recognizing oneself in a mirror. This is an early indicator of cognitive decline. Refusing to eat, frequent urination, and complaining of headaches are not specific early signs of dementia. Clients with Alzheimer's disease may have all of the following characteristics except A, physical wasting away, B, memory loss, C, wandering, D, I'm sorry, I'm so tongue twisted. Irritability. Drop your answers in the chat. Drop your answers in the chat. If you chose A, you are absolutely correct. Physical wasting away. Alzheimer's disease primarily affects cognitive functions such as memory, thinking, reasoning. It can cause symptoms like memory loss, wandering, irritability, and difficulty performing daily activities. Physical wasting away is not a typical characteristic of Alzheimer's. However, other diseases like advanced cancer or severe malnutrition can lead to this. When a client turns on the call light every few minutes, the appropriate response is to A, ask the client not to call so often, B, place the call light out of reach, C, stop by the room more often, D, tell the client how busy the staff is. Drop your answers in the chat and let me know what you think it is. Drop your answer in the chat. Let's go ahead and dive right into the answer. If you chose answer C, you are absolutely correct. Stop by the room more often. If a client is frequently using the call light, it may indicate anxiety, discomfort, or need for reassurance. The best approach is to check on the client more often to address their concerns proactively. Telling the client not to call, placing the call light out of reach, or telling them how busy the staff is would not address the underlying reason for the frequent calls and could contribute to feelings of neglect. The doctor writes an order for do not resuscitate DNR. What does that mean? A, put the client on a machine if she stops breathing. B, the client needs to be kept alive. C, CPR will not be performed. D, start CPR immediately if the client stops breathing. Drop your answer in the chat. Drop your answer in the chat. Let's dive right into the answer. If you chose C, you are absolutely correct. CPR will not be performed. A do not resuscitate DNR order means that in the event of the client's heart stopping or they stop breathing, cardiopulmonary resuscitation CPR will not be performed. The DNR order is intended to prevent unnecessary or unwanted interventions at the end of life, allowing the client to die naturally. It does not imply that all care should cease, just that resuscitation efforts should not be attempted. How a client reacts to illness and disability is most dependent on his A, age and stage of life, B, spouse's support, C, income and level of education, D, support system and life history. Drop your answers in the chat and let me know what you think it is. A, B, C, or D. A, B, C, or D. Let's go ahead and dive right into the answer. If you answered D, you are absolutely correct. Support system and life history. A client's reaction to illness and disability is largely influenced by their support system, family, friends, caregivers, and their life history, previous coping mechanism, personality, values. Age, spouses, support, and income can play a role, but are secondary to the client's overall coping abilities and past experiences. A client with dementia makes sexual advances towards another client who has dementia. The nurse aide should A, allow it. Oprah 87 states that clients must be allowed to fulfill sexual needs. B, ask them to keep their sexual activity in a private place. C, ignore it so it's not as embarrassed to embarrass them. D, tell the charge nurses the client with dementia is unable to give consent. Drop your answers in the chat. A, B, C, or D. Let's dive right into the answer. If you chose answer D, you are absolutely correct. Tell the charge nurse since a client with dementia is unable to give consent. Clients with dementia may not have the ability to understand social boundaries or give consent to sexual activity. The nurse aide should inform the charge nurse about the situation to ensure proper handling and to protect the dignity and safety of all individuals involved. Ignoring the behavior, allowing it, or directing them to be private without addressing the issue is inappropriate. A client hits a nurse aide during lunch. The appropriate response is to A, call the charge nurse for help, B, continue to feed her, C, apply restraints, D, yell at her to stop hitting. Drop your answer in the chat. All right, let's go ahead and dive right into the answer. See a lot of A's. Let's see. If you chose A, you are absolutely correct. Call for the charge nurse for help. If a client hits a nurse aide, the first step should be to seek assistance from the charge nurse to address the situation properly. The charge nurse will provide guidance and ensure the situation is handled appropriately. Continuing to feed the client, applying restraints, or yelling would not resolve the situation and could escalate the issue or cause harm. A resident is confined to her bed. What might keep her from getting pressure sores? A, a plastic draw sheet. B, a footboard. C, body lotion. D, air mattress. Drop your answers in the chat and let me know what you think it is. A, B, C, or D. Drop your answers in the chat. Let's dive right into the answer. If you chose D, an air mattress, you are absolutely correct. An air mattress helps prevent pressure sores by redistributing pressure, which reduces the chance of skin breakdown. Pressure ulcers, bed sores are caused by prolonged pressure on the skin, which cuts off blood flow. Air mattresses are specialized pressure relieving mattresses, helps to prevent this by constantly adjusting the body's weight distribution. I'm sorry, y'all. If the client is in a traction, the nurse aide should never A. Monitor affected skin temperature, B. Give a total bed bath, C. Change the position of the weights, D. Monitor distal pulses. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Change the position of weights. In a patient with traction, the weights are part of the mechanism that aligns the bones and stabilizes fractures. Changing the position of the weight could interfere with the effectiveness of the traction or cause injury. The nurse aide should always follow specific guidelines regarding the care of a client in traction, including not adjusting the weights or equipment. Security for a client's dentures includes A. Keeping them in a tissue in a dresser drawer. B. Placing them in a labeled denture cup. C. Assisting the residents wear the dentures. D. Placing an identifying mark on the denture. Drop your answers in the chat. Security for the client's dentures includes A, B, C, or D. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Placing them in a labeled denture cup. Dentures should always be kept in a labeled denture cup to avoid confusion and ensure that they are safe and hygienic. A labeled cup helps prevent the dentures from being misplaced, ensuring the client's personal property is secure. Keeping them in a tissue in a drawer or assisting the client wear them unnecessarily are not secure practices. If family members bring new clothes in for a resident, the nurse aide should A. Put them in the resident's dresser drawer. B. Make sure the charge nurse sees the clothes. C. Ask the family to remove an equal number of old clothes. D. Label them with the resident's name. Drop your answer in the chat and let me know what you think it is. A, B, C, or D. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Label them with the resident's name. It is essential to label new clothes with the resident's name to prevent confusion and ensure that the clothing is correctly attributed to the residents. This helps avoid mix-up in laundry and clothing identification. Simply putting the clothes in the resident's drawers, asking the family to remove old clothes, or notifying the charge nurse are not sufficient steps for proper clothing management. The charge nurse instructs the nurse aide to clean a resident's closet. The nurse aide should A. Ask the family to do it. B. Get another nurse aide to do it. C. Enlist help from the client. D, have the client do it. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Enlist help from the client. Involving residents in cleaning their closet, if possible, promotes their autonomy and dignity. It encourages participation in their own care and can be an activity that helps maintain the residents' functional abilities. Asking family members, other nurses, aid, or the client to do it entirely may not be effective or respectful depending on the resident's capabilities. Before dressing a resident, the nurse aide should A, put on gloves, B, choose the client's clothes, B, close the door, D, report to the charge nurse. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Close the door. Closing the door ensures privacy and maintains the dignity of the residents during dressing. It's important to respect the residents' privacy and avoid any unnecessary exposure. Checking the order, choosing the clothes, or reporting to the charge nurse are not typically necessary steps unless specified in the care of a plan. Confidentiality refers to A, never sharing client information, B, the client's right to privacy, C, not documenting information in the client's chart, D, the client's right to have insurance. Confidentiality refers to A, B, C, or D. A, B, C, or D. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. The client's right to privacy. Confidentiality refers to respecting the client's right to privacy, which includes not sharing personal or medical information without the client's consent or a legitimate reason. It is crucial to protect sensitive information, and this concept is fundamental to healthcare ethics and laws such as HIPAA. Not documenting information or never sharing client information inappropriately are related, but not the full definition of confidentiality. Oh, excuse me. During AM care, the nurse aide nicks a resident while shaving him. What should she do first? A, report to the charge nurse. B, do nothing. C, apply pressure and stop the bleeding. D, place a Band-Aid on it. Drop your answer in the chat and let's dive right into the answer. If you chose C, you are absolutely correct. Apply pressure and stop the bleeding. The first step after nicking a resident while shaving is to apply pressure to stop the bleeding. Once the bleeding is controlled, the nurse aide should report the incident to the charge nurse, document it, and ensure appropriate follow-up care. Putting a bandage on the nick may also be necessary, but controlling the bleeding comes first. Maintaining good interpersonal relationships depends on A, agreeing with the crowd, B, communicating clearly with others, C, following orders without questions, D, avoiding contact afterward. Drop your answers in the chat. Drop your answers in the chat. Let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Communicating clearly with others. Clear communication is key to maintaining good interpersonal relationships. Effective communication helps prevent misunderstandings and ensure that all parties involved can work together effectively. Agreeing with the crowd, following others without question, or avoiding afterward contact are not as important as open and honest communication. If a nursing assistant does not know how to complete an assignment, he should A, ask another nursing assistant, B, ask the client for his preference and contact the charge nurse for help, D, utilize a policy manual. A, B, C, or D. Drop your answers in the chat. See a lot of C's. Let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Contact the charge nurse for help. If the nurse aide is unsure about how to complete a task, it is essential to ask the charge nurse for guidance. The charge nurse is in a position to clarify instructions, ensure proper care, and provide necessary training or resources. Asking another nurse aide, the client, or using a policy manual might be helpful but should not be replaced seeking assistance from the charge nurse. Reporting what the client tells you is an example of what? A, subject observation, objective observation, C, primary observation, D, secondary observation, observation. This weather here in Florida is like really, really cold. And if you are in Florida, you know anything below 75 is like cold. If you are a real Floridian, we cannot take the cold. All right, drop your answer in the chat. Let's go ahead and see what the answer is. If you chose A, subjective observation, you are absolutely correct. A subjective observation is based on the client's personal experience, feelings, or statements. For example, if a client tells you they are in pain or feeling dizzy, this is subjective information. Objective observation, on the other hand, are measurable and observable facts, such as vital signs or physical feelings. Incontinence means that the patient is A, unable to make decisions, B, unable to speak, C, experiencing a disorder that comes from dementia, D, experiencing a disorder that comes from weakened muscles. A, B, C, or D. Drop your answer in the chat. Go ahead and drop your answer in the chat and let me know what you think it is. All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Experiencing a disorder that comes from weakened muscles. Incontinence refers to inability to control the bladder or bowel, often resulting from weakened pelvic floor muscles, nerve damage, or other physical impairments. While it can sometimes be associated with conditions like dementia, incontinence itself is primarily a physical condition related to muscle or nerve function rather than cognitive ability. Failure to raise the side rails on the bed of a confused client is an act of A. Malpractice, B. Negligence, C. Overcommission, D. Breaking a criminal law. Drop your answers in the chat and let me know what you think it is. A, B, C, or D. I see some B's, and let's go ahead and dive right into the answer. If you chose B, negligence, you are absolutely correct. Negligence occurs when a healthcare provider fails to meet the standard of care and causes harm or puts a client at risk. In this case, failing to raise the side of the rails on a bed for a confused client could lead to injury, such as falling out of bed, which constitutes negligence. Malpractice involves more serious breaches of care, while overt commission refers to direct action causes harm, which doesn't apply here. Excuse me. During a job interview, it is important to tell the interviewer about A. Qualification, B. Childcare needs, C. Scheduling problems, D. Salary expectations. Go ahead and drop your answers in the chat. A, B, C, and D. Drop your answers in the chat. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose A, qualifications, you are absolutely correct. The job interview is the appropriate time to discuss your qualifications, skills, and experience relevant to this position. Discussing personal matters such as childcare needs, scheduling problems, or salary expectations may be appropriate later in the hiring process, but are not focus of the interview itself. The primary goal is to demonstrate that you are qualified for this role. When a nurse aide cannot do due to illness, the nurse aide should A. arrange for someone to cover his or her shift, B. call the charge nurse of the hour before the shift begins, C. contact the supervisor as soon as possible, D. wait until the charge nurse calls to find out where the aide is. Drop your answers in the chat and let me know what you think it is. I see a lot of B's rolling in. I see some A's. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Contact the supervisor as soon as possible. It is important for the nurse aide to inform their supervisor or charge nurse as soon as possible if they cannot work due to illness. This allows the facility to make arrangement for coverage. Simply waiting for the supervisor to call or try to arrange the coverage personally may lead to delay in finding replacement. What is the main goal of OBRA 87? A. To provide a safe environment for residents of extended care and hospice facility. B. To provide prompt payment of care costs for residents covered by Medicare and Medicaid. C. To make sure that healthcare providers meet the requirements nationwide by passing the competency and skills tests to provide quality care. D. To shorten the hospital stay of patients who can be attended at home by nurse side. Drop your answers in the chat and let me know what you think it is. Okay, I see a lot of C's. Let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. To make sure that healthcare providers meet the requirements nationwide by passing a competency and skill test to provide quality care, OBRA 87 set national standards for nursing assistant training and competency tested to assure healthcare providers are properly trained and provide quality care. The client asks to see a priest. The nurse aide should A. Ask the charge nurse to call a priest. B. Tell the client to see if a priest walks by his or her door. C. Call the doctor. D. Tell the client to call herself. Drop your answer in the chat and let me know what you guys think it is. Drop your answer in the chat. Let's go ahead and dive right into the answer. If you chose answer A, you are absolutely correct. Ask the charge nurse to call a priest. The nurse aide should refer the client's request to a charge nurse who can arrange for the appropriate spiritual care, such as calling a priest. It is important to respect the client's religious needs and follow proper protocol for requesting such services rather than telling the client to handle it themselves or try to take action independently. When caring for a client who had just been placed on NPO, the nurse aide should first A. Encourage the client not to think about food and water. B. Encourage the client to eat and drink. C. Remove the water pitcher and all items of food and drink. D. Give the client musculus mouth care. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Remove the water pitcher and all items of food and drink. If a client is placed on NPO, all food and drink must be removed to prevent any accidental intake. NPO orders are typically given before a procedure or surgery and need to be followed strictly. While mouth care is important, removing food and drink is the immediate action needed to comply with the care. If a nurse aide sees another employee hit a client, the nurse aide should A. Tell the employee to stop. B. Keep an eye out to see if it happens again. C. Tell another nurse aide. D. Report it to the charge nurse immediately. Drop your answer in the chat and let me know what you think it is. A, B, C, or D. A, B, C, or D. Let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Report it to the charge nurse immediately. Any instance of abuse should be reported immediately to the charge nurse or a supervisor. This ensures that the situation is properly handled and further harm is prevented. Confronting the employee, waiting to see if it happens again, or discussing it with another nurse aide are not appropriate responses when it comes to safeguarding the client's well-being. Which statement about mouth care for unconscious resident is correct? A. Unconscious residents may be able to hear you speaking to them during mouth care. B. Unconscious residents can both swallow and spit. C. Unconscious residents do not need to be observed for mouth sores. D. Unconscious residents have very moist gum tissue. A, B, C, or D? Drop your answers in the chat and let me know what you think it is. A, B, C, and D. All right, let's go ahead and dive right into the answer. If you chose A, you are absolutely correct. Unconscious residents may be able to hear you speaking to them during mouth care. Even though unconscious residents may not respond, they still hear and be comforted by familiar voices. Speaking softly to them during mouth care can provide reassurance. Unconscious residents may not be able to swallow or spit effectively, and they do not require observation for mouth sores as they are at higher risk of oral hygiene problems. A hearing impaired client has the right to all of the following except A. Written notes, B. An interpreter, C. Assistance with hearing aid, D. Purchase of the most expensive hearing aid. A hearing impaired client has the right to all except of the following except Go ahead and drop your answers in the chat and let me know what you think it is. See some D's, I see some A's. Let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Purchase of the most expensive hearing aid. While a hearing impaired client has the right to assist with hearing aids and may request an interpreter or written notes, they do not have the right to demand the most expensive hearing aid. Facilities provide assistance with hearing aids based on medical necessity and coverage, not based on personal preference for expensive options. When documenting a client's vital signs, the nurse aide makes a mistake. The nurse aide should A. Cover the mistake with heavy black marker, B. Cover the mistake with correction fluid, C. Make a single line over it, write error and initial it, D. Ignore it. Go ahead and drop your answer in the chat and let me know what you think it is. All right, see some C's and D's. Excuse me. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Make a single line over it, write error, and initial it. If a mistake is made in documentation, it should be corrected properly by drawing a single line through the error, writing error, and initialing it. This maintains the integrity of the record while indicating the change. Using correction fluid or markers is not acceptable as it could be seen as trying to hide or alter the information. All right, you guys, thank you so much for watching and hanging in there with me tonight. You can comment, like, share, subscribe. Once again, my name is Phyllis. You have been tuned into Florida training. So any comments or concerns, you can drop them in the chat. You can like it. You can share it. Don't forget to subscribe it. You guys have a wonderful rest of if it's nighttime where you are, have a good night. If it's morning, have a good morning and a good rest of your day. And be on the lookout for me again later on this week. You guys have a good one. Good night.